Hello and welcome in nursing webinar session. Today we are going to discuss about the very prevalent topic on spinal cord injuries and its management. And let us see who we have in today's session as an expert panelist, none other Dr. Vamshi Krishna Garu, who is our the spine surgeon from Secunderabad, the Yashoda Hospital. It has been a very great honor and privilege to share the session with you, sir. And as everybody knows that you're very highly skilled and marvelous and very able and eminent surgeon as well. So I welcome you for this session, sir.
Thank you, Shanti, for the good words from you on the afternoon of post lunch. Thank you so much for inviting me to be an expert panelist.
And let us also welcome Ms. Ratna, who is from Yashoda Unit, Malakpet, who is also a nurse manager from Neuro Intensive Care Unit. I welcome you, Ratna.
Thank you, ma'am.
Yeah, you can start sharing the slide as we are going to discuss about the prevalence. As we can go for the first slide.
Yeah, ma'am.
Yes.
Yes, ma'am.
It's okay, no problem. So, sir, like we were talking about the prevalence, you can start sharing, Ratna.
Yes, ma'am.
So, yes, the prevalence of spinal cord injuries in India, this may be a little bit of scant data or not, roughly estimated maybe. In India, more than approximately 1.5 million people live with spinal cord and approximately 20,000 new cases of, these injuries are every year added. But we would like to also have your insight on this, discussion.
Yeah, one thing we have to understand is a spinal cord injury is a very serious disease in spinal injuries, because if one person has a spinal cord injury in the family, I tell the family that the whole family becomes paraplegic, because somebody has to be with the patient always. Somebody has to take care of the patient. Okay, so in today's world, if one person is a paraplegic, the whole family is paraplegic. It is financially, there is a huge burden, as well as a psychological burden on the patient, as well as the patient's family. So that's why it is better to not have a spinal cord injury. So we have to be careful about it. I'm looking forward for the slides from Ms. Ratna. Yeah.
Very true. As you mentioned, if one person is affected, the whole entire family has been burdened. Yes. Not in terms of activities of daily living, yes, as well as for the economic burden as well. Yes. That's now second slide. Yeah, third slide. Yeah. So again, age group is again we have seen when I was just going through the few of the literatures and all. Mostly the males are affected, and the age group is between 16 to 30. And also 11.5% is older than 60 years. So which group has a higher prevalence, sir?
It is the men who are young, immature, who just started their college with their motorbikes, yes, who are ready to explore the world, try to do so many things without understanding what is going to happen if there is a motor vehicle accident and all these things. And today's world, it is not only the motor vehicle accidents, what we see, again, there is a lot of people falling from heights and all these things. With the new social media coming up, people want to show themselves on the social media doing some kind of attempts and feats. I see some of these patients coming now in this era who try to do something there and coming up with a spinal cord injury, falling from heights or jumping from building to building and all these things. Yeah. So we have to be extremely careful. We have to educate these patients and these people, majority of them who are social media crazy, to understand what can happen to their lives if they try to jump from building to building or bike to bike or motor racings and all these things. So that's why you have to be very careful. And this is the age group we see most of the times in their 20s, who are just in college with the motorbikes trying to do something. So that's the reason why the age group is between 16 and 30. This is the most unstable age of many of us.
Yes, especially the young adolescents, as you have said, they try to explore a lot. Yes. So that's how the injury is.
You don't have a control at this age. That's why these injuries happen at that age.
Yeah. Ratna, over to you for the rest of the session.
Thank you, ma'am. Good afternoon, Nandal. What is the spinal cord injury? Damage to the spinal cord that result a loss of function such as a mobility or sensation.
So, sir, again, why this spinal cord injury, as you have already mentioned in the previous slide, that it is again socioeconomic burden and healthcare burden as well.
Yes.
And does it also affect person's voice?
Voice?
Yes, speaking.
No, it normally doesn't affect the person's voice because it is controlled by the upper nerves and the brain. So it doesn't help. It's only the limbs, all four limbs or two of the limbs can get affected with the spinal cord injury. And breathing. Breathing is one thing which gets affected with spinal cord injury. Yeah, people can talk. That is the problem with spinal cord injury. Yeah.
In spinal cord, it is intact with the brain. It consists of nerves that connect to the brain. Like it's a superhighway for the messenger between the brain and to the body.
So if once these spinal nerves are affected or injured, or it is, some condition which is happening, does, again it regrows maybe after your intervention, or maybe it regrows or rejuvenates within the time period?
Yeah, the problem with the spinal cord is if the regrowth depends upon the kind of injury, what has happened. If it is a significant injury, spinal cord normally doesn't heal. It's not like the skin or the bone. Spinal cord is a different organ. It is very sensitive. The brain and the spinal cord, they normally don't heal if the injury is very significant because the circuit in the spinal cord is so complicated. We cannot repair the spinal cord. Spinal cord has to get repaired by its own. It has to get repaired on its own, and we don't have any medications or anything which can repair a spinal cord or a surgery which repairs the spinal cord. We can only repair anything around the spinal cord, not the spinal cord. Yes.
Look at the anatomy of the spinal cord. There are the 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. When we become like an adult, and the sacrum fuses from the 5th vertebrae, and coccyx fuse from the 4th vertebrae.
So as we look into the anatomy also, and as we were just discussing few slides, that as the traumatic spine injuries and all, how long the recovery takes place, sir, a rough estimate?
Again, it all depends upon the type of injury, what has happened. Okay, it can be few days to few weeks to few months if the recovery happens. So we have to wait at least for 7 to 9 months to know whether the patient is going to recover or not going to recover after the spinal cord injury.
Yes.
And let's see the traumatic spine injury. It is that abuses partially tear or completely tear the spinal cord, and common cause of the spinal cord is a disability and death in the children and adults.
So, sir, as nowadays, because of the very great healthcare system and tertiary care, like this, when we are talking about the disability, just because the disability does, because a lot of rehabilitative centers are, there in the India. So still the person or, patients have this permanent disability.
Yes, again, it all depends upon where the injuries have happened, whether it is in the neck, which there is a spinal cord injury, or whether it is between your lower vertebrae and between the neck. So if there is a neck is injured, your all 4 limbs are paralyzed. Okay, even if they're partially injured, if you repair the bone, if you decompress the spinal cord, if the patient recovers, well and good. All these rehabilitation centers will help in your gaining your strength and all these things. Whereas if there is a patient has a paraplegia, that is below, if the legs are paralyzed, his hands are good, but with the hands, the rehabilitation centers can do a lot of work on these patients, occupational as well as physical therapy, in helping them to get back to their work, at least some kind of work they can do. Because whereas in the neck injuries, the hands don't work, whereas the injuries below the neck, your legs are not working, but your hands are working. If your hands are working, you can do much more than having all 4 limbs paralyzed. So these are the places where the rehab centers work pretty well on these patients.
Coming to the types of the spinal cord, it can be complete or incomplete. Coming to the complete spinal cord injury caused to paralysis below the level of the injury. It affects both sides of the body. You have seen the picture. Here it was. It was a complete spinal cord injury, and it also causes for a paralysis of the four limbs and all over half of the body also. And coming to the incomplete, and after the incomplete injury, spinal cord injury, some functions remains on one or both side of the body. The figure has shown this.
So I think, yes, you did mention in case of this quadriplegia and partial hemiplegia and all. Yes.
No, it's like if complete injury is there is a complete loss of sensations and motor functions in the body. Incomplete is patient. See, there are grades for the power in the muscles. So incomplete injury, patient has some grade of muscle power in these patients, patients who had a spinal cord injury. See, these are the patients who has high chances they'll recover. They'll get back to walking and get back to do their activities. Whereas these complete injury patients or the patients, we are not sure whether they are going to get back to the normal activities or they are going to be handicapped forever in life. Yeah.
And completely bed bound, maybe 9 or more than a year.
Yes.
Here we can, coming to the slide of causes, there is a road accidents and falls, violent, sports injury, and injury birth during the birth. It means, for example, like a spina bifida.
So as we were mentioning also, slips, fall, road accident, and all this. Any other causes we have forgot to mention here? So
70% of the times, the reason for a spinal cord injury are road traffic accidents and fall from heights. And there are certain patients, as I said, the social media is the one which is affecting. And then sports injuries. Yeah, these are the patients who we see. Otherwise, rest of them are pretty negligible what we see in India. Yeah, the diseases and all these things, we are not going to talk about them. Primarily, we're talking about the spinal cord injury in trauma.
Yes.
Yes.
Other than the trauma, there are chances of infection and congenital disabilities and deformation of the vertebrae column.
So as we were mentioning also, like spinal infections also we get to see, but that is again a different set of
So that's a different set of this thing. That is a slow and progressive disease, whereas spinal cord injury in trauma and fall from heights is completely different. So I think now we are more focused on acute injuries than injuries which can happen with the other diseases.
Yeah.
And also we can see spinal deformities like here you can see the slide is showing that this is the normal spine, atherosclerosis, and this is the combined scoliosis, and here is the normal spine and kyphosis and lordosis.
So sir, I think these are all congenital spine deformities, and will this also be corrected? Like, do you also intervene?
We intervene on these patients if the curves are more than 40 degrees. It may be a kyphotic curve or a scoliotic curve or a kyphoscoliotic curve. Yes, we do operate on these patients. They do pretty well. And these patients causing spinal cord injury is extremely rare unless and until the curve is more than 120 degrees. Yeah.
It's great to know that it has got some parameters or benchmark of the degrees where you intervene. Thank you.
It is. So we don't operate every patient who comes with smaller curves and all these things. Yeah.
Let us see the risk factors. Age-related, age above the 65 years and fall from height, axial load to the overweight of the head, and accidents, and etc.
Yes, again, axial load to the head, like maybe we see the coolie and laborers and all. Do also they contract this injuries or some trauma or some pain?
So they can also have these injuries because I do get some patients who work in these fields of lifting weights and all these things. They might lift that weight correctly every day, but that one day which might slip and fall on his back or his neck and injure his spine and lead him to the spinal cord injuries. This can happen. We keep seeing them, not very often, but there are significant cases which we come to us who are working in this industry.
Yes.
Coming to let's see the signs and symptoms of the spinal cord. There is a loss of limbic movement and tingling sensation, loss of bowel or bladder control, exaggerated muscle movement and spasm. Mainly we can see in the hemichoiasis cases, this type of symptom, and may or may not difficulty breathing or coughing and balance issue.
So I think as you were mentioning, with the sign symptoms only, the patient has to have the recovery, and many of the signs and symptoms are being taken care by you all. And what else we get to see, sir? Anything apart from this?
Breathing is a problem.
Yes.
Okay, if there is an upper cervical spine injury, because that is the one which affects the diaphragm. So these patients also, some of them can be ventilator dependent. Okay, because of injury to those nerves which are responsible for his breathing and all these things. Other than anything lower cervical spine and below, we see only in a long-standing cases patient developing pneumonias and all these things after having a spinal cord injury. Yeah.
And coming to the on-site emergency interventions, here any emergency of the spinal cord injury, then immediately we can strictly immobilize the head and neck of the with the help of the neck collar. And victim need to be transferred as much as possible with the help of the spinal cord and to the nearby the hospitals.
So on-site emergency, any other, these are the few very prime vital interventions which one should take place.
Yeah.
And
see, on-site, spinal cord injuries happen, one, at the time of injury, two, when you're transporting the patient.
Yes.
Okay. So transporting the patient implies whenever there is an accident, all of us want to help the patient.
Yes.
So to help this patient, one of them will hold the neck, one of them hold the hand, one of them hold the back, one of them hold the legs. There are 5 or 6 of them are trying to help the patient. This is one. The secondary spinal cord injuries will happen. Okay. The first and foremost thing to understand whenever there is an accident or anything, everybody should think there is a spinal cord injury, in spite of the patient not having a spinal cord injury. Okay. That is the first thing what we have to understand. So that's why I tell whenever I go to any meetings and all these things, it is the duty of the government and health organizations to put some slides and ads on televisions between as commercials when they're getting in, to tell the patients what is important, how the patient has to be shifted, how the patient has to be taken care whenever somebody has a fall at home, road traffic accidents, or fall from height. This is one, only then they can understand how they have to, whether they have to log roll the patient, carry the patient as a log, what can be done, and what is the nearest things, because we don't get a collar or a table which is hard to shift the patient. So we should know what we can make. These are the things what the government and organizations like us should educate the people.
Yes.
So that's what I try to tell any patient who come to me with a spinal cord injury, to their relatives, that what they have to do. So this is how it is. The first and foremost is just don't pull and try to save the patient. You have to be as careful as possible. And first thing is treat every patient unless and until it is proven radiologically as a patient with spinal cord injury. Yeah.
So very beautiful informations you have provided. It is, very, very important that when we, we get to see and we get to witness heaps of patients by roadside, and we just, shifted them as because we want to prevent their, other associated injuries. Yes, we request, and maybe we will like to take also the awareness on whatever you have just provided to us. Yeah, thank you. Yeah.
And look at the initial assessment at emergency, hemodynamically stability. Hemodynamically stability means vital parameter need to be stable in the patient. And a primary survey, ABC. ABC means airway protection and breathing and circulation. A secondary survey is a trauma pathway. Rather coming like medications, anti-analgesics priorly need to administered, and steroid, antihypertensives.
So I think these are the basic golden rule of intervention when the patient step into our ER. And we would like to also know whether the role of steroid is initially given.
No, not anymore. The NASA's trials have all not anymore. We are following any of these parameters, patients with the spinal cord injuries, because they have proven time and again, but they have not make any difference in giving the steroids on the patients with spinal cord injury. In my this thing, I don't give any steroids to these patients. Yes.
Coming to initial investigations like such as a blood investigations in like a major surgical profile or minor surgical profile, and radiology investigation like a X-ray and CT scan. Whereas seen in the MRI, we can easy to identify the tissue damage or nerve damage or in the muscle damage. We can see the preoperative area and preoperative care. In that, EAC and consent are in the investigations, all reports and site of the preparation are in the blade if required. Right hand over to the preoperative nurse or OT nurse.
Can we go to the slide 16?
Yes, sir.
Slide before, yeah. See this one, X-ray, CT and MR. The good thing what happens in our hospital is whenever the patient comes with a polytrauma, we do this polytrauma CT scan. So it is a quick investigation to check from head to toe what kind of fractures and where the fractures are and all these things, and then the X-rays and MRIs and all these things. So CT is very fast. It tells us whether the patient has a significant injury to the spine or any other things in the body. So this will help us in saving the patient as well as saving the time. So that is one thing which is good with our hospital. We always do that whenever the patient comes in.
Yes.
Before we ask for an MRI or anything. MRI is the next investigation what we ask after we feel that if there is something there on the spine. Yeah.
We can go to the post-op care. Yes.
Let us see the post-operative care. Air mattress. Need to be address the air mattress before the patient receives and administer the DVT prophylaxis, mobilization and chest physio, pain medication administered, and good nursing care. To good nursing care only the patient will improve the activities and it is easy to get discharge.
So during all this pre-operative and post-operative period, any other precautions what nurse should take for the patient's safety, sir?
Absolutely, yes. As I said, unless and until it is proven patient with the spinal cord, without spinal cord injury, patient with injury has to be treated like a spinal cord injury. The log rolling, like preventing DVT, preventing bed sores, okay, these and infections of the urine and the lungs. These 5 are the things which are very important, which has to be taken care in the hospital. So the first thing when I get into the patient post-surgery, the next day is whether the patient has developed a bed sore, because the bed sore develops in less than 2 hours time. So we have to be extremely careful in treating these patients. And nursing care is the one which is important after the post-operative care, because that is what is important to these patients, because surgery is straightforward. I know what I have done, but when the patient who is not able to do his activities, that's where the nursing comes in. That makes a lot of difference.
Yes.
Let's see in case of it happens like do after that procedure of any spinal injury or post-operative care, it might be infection at the surgical site. As you've seen here, the slide was showing that.
Yes, sir.
Yeah, and pressure ulcers, it may or may not, and abnormal parameter, vital parameters.
So yes, as sir was rightly mentioning, the patient might have pressure injury because nursing care has to be taken place. Yes. Next.
And coming to the surgical interventions like spinal surgeries like discectomy, laminectomy, and cervical laminectomy, and also lateral mass fixation, and also it includes spinal fixation as 2 types. There are a case and grafting.
So all these procedures we get to see, sir, whenever we just read the notes documented by you all.
Yeah.
And in terms of spine fixation, we also didn't know that there will be a procedure called cage and fixation. And
yeah, absolutely. We put cages when the bone is absolutely damaged. So to give that support between the bones, we use cages to support the bone.
these cages Artificial, like?
Yeah, they're artificial, they're metal, the titanium cages. Yeah, we use them to support the spine.
Great. And this is again, yes, Ratna, go for the next slide, log roll. Yes, I think importance of log roll, as we were mentioning, that patient without any flexion and abduction, we need to shift the patient. And here, if you see the sliding board, we at Yashoda Hospital, we use the sliding board for shifting the patient from bed to chair and chair to bed. Yes. So this importance of log roll has to be practiced, I think. Yes, sir.
It has to be practiced day in and day out. There's no other way.
Yeah.
Yeah.
Yeah. Any other? Yes. Yes, you can talk about 22nd.
Yeah. Let's see the complications of the spinal cord injury. And there is a chronic pain and urinary tract infection, loss of bladder and bowel control, pressure ulcers due to the long-term immobilization, pneumonia and depression. It may chance of the DVT risk.
So chronic pain, will that be there, sir? With, as you said, it depends on the type of injury.
Yes.
And maybe likely this depression will continue to happen because patient is bed bound and not able to perform the activities of daily living.
Yes.
Apart from this, any delayed complications?
Delayed complications there can be if we use an implants, the implants can get failure. Okay, we can have again recurrent infections in the spine because the muscles are not active there. Okay, they're not supporting the spine because they're paralyzed. So these are the patients where we can have delayed complications, like we can have stiffness in the legs, stiffness in the arms. Okay, all these things have to be looked into and addressed before they develop. We have to anticipate that this patient is going to have certain things and design a plan for a patient with a spinal cord injury. Depends upon where the injury is.
Yeah. So I think we have come to the end of the session. We also will see, share your slide, preventive aspects. Okay, no problem. Preventive aspects, sir, would you like to just provide your insight on how one should prevent, as you were saying, wearing the seat belt, avoiding the bikes and, by adolescents and all, and maybe physical activeness also is important. What else would you just like to quote to the audience and the learners?
Yeah, see, the first thing what we have to understand is, one, we have to respect the traffic and follow the traffic rules.
Very right, yes.
Two, we have to wear a helmet when we are riding a bike. We have to use a seat belt whether you're sitting in the front seat or in the back seat. You have to do that. No jumping between the buildings. Okay, just to show that you are a hero on social media. These things should not be done. Okay, and then discipline. Discipline is very important. Okay. Like people tell me that somebody comes to me with some kind of an disc prolapse with some weakness. They come in and they ask me, can they drive? I reject them driving. I tell them that you cannot use your foot because I might be somebody who may be walking in front of you, and you cannot use that brake.
Yes.
So it's not only you're going to injure so many people if you try doing these things, if you have weakness in your legs and your hands. So these things should not be done, especially old people after a certain age. I don't think they should ride or drive anything because the reflexes are slower. Okay. You have to be careful, not only about them, but the people around them who are walking, riding, cycling, or biking, especially in these ages. So these are the few things which you have to follow. Then we can probably at least decrease the kind of spinal cord injuries what we there, because these road traffic accidents and fall from heights, for 100%, we are responsible for these things. There's nobody else is responsible for these injuries. Yeah. So
yeah, very wonderful session we had, very small, and it was very crisp. And I think I request all the learners, if you have learned something out of this, session, please raise the awareness among your colleagues and your family members, to your, neighbors. And thank you so much, sir, for your, wonderful and precious time you have spent with us. And thank you, Ratna, for the wonderful speaking.
Thank you, Shanti. It was wonderful with you guys, and Ratna, it's a wonderful presentation. All the best. Good luck to you. Yeah. Thank you.
Thank you, sir.
Bye.
Bye.